Let's talk about vaginal discharge. It's something we all experience but rarely discuss. But here's the truth. Vaginal discharge is totally normal. It's your body's way of keeping things clean and healthy down there. Discharge is just the byproduct of that process. So, let's break the silence and decode those vaginal discharge signals. We'll talk about what's normal, what's not, and when it's time to call in the professionals. Your body speaks to you in many ways. Vaginal discharge is just another way your body communicates. The color, consistency, and even the smell of your discharge can offer clues about your vaginal health. Sometimes it's a sign that everything is A-OK. Other times it's a heads up that something might be off. We'll cover the different types of discharge, what they mean, and what to do if you notice something unusual. Let's be honest, talking about vaginal discharge can feel about as comfortable as wearing wet jeans. But it's time to ditch the shame and embrace open conversations about our bodies. Ignoring potential problems won't make them disappear. So let's get real, ladies. Let's arm ourselves with knowledge and take control of our vaginal health. So grab a cup of tea, get comfortable, and let's dive into the world of vaginal discharge. First up, let's talk about yellow-green discharge. This is one signal you definitely don't want to ignore. We're talking about a sexually transmitted infection, STI, called trichomoniasis, or TRICH for short. It's more common than you might think, but definitely not something you want to have on your to-do list. Imagine this. Your vagina is hosting a party, but instead of fun music and tasty snacks, there's a frothy, smelly, yellow-green situation happening. Not exactly the vibe, right? That's TRICH trying to crash the party, and it's our job to show it the door. Here's the thing about TRICH, it's a sneaky little bugger. It's caused by a parasite, which is basically a tiny organism that likes to live rent-free in your body. And get this, over 270 million people around the world have it. Many women don't even know they're infected. Why? Because TRICH often plays the silent game, lurking in the shadows without causing any symptoms. That's why getting tested regularly is key, even if you think everything's peachy down there. Remember, knowledge is power. The more you know about STIs like trichomoniasis, the better equipped you are to protect yourself and your partners. If you notice that telltale yellow-green discharge, or even if you just have a gut feeling that something's off, don't hesitate to reach out to your doctor or a trusted healthcare professional. Getting tested is quick, easy, and often painless. And if it turns out you do have TRICH, don't panic. It's completely treatable with antibiotics. Okay, ladies, let's talk about red or pink discharge. Now, before you hit the panic button, remember that context is key. Sometimes, a little rouge in your undies is no big deal. If you're spotting a bit of pink or red around the time of your period, it's usually nothing to worry about. It could just be your body's way of easing into or out of your menstrual flow. However, if you notice red or pink discharge at any other point in your cycle, especially after having unprotected sex, it's a different story. This could be a sign of something more serious, like an infection or even a hormonal imbalance. Let's dive a little deeper into the times when pink discharge is considered normal. For instance, you might notice a bit of light pink spotting around the time you ovulate. This is often called ovulation bleeding and is caused by a drop in estrogen levels. Another instance where pink discharge is usually harmless is after sex. This is often called post-coital bleeding and can be caused by a number of things, like a sensitive cervix or a small tear in the vaginal lining. While it's usually nothing to worry about, it's always a good idea to mention it to your doctor at your next checkup. Now, while some pink discharge is par for the course, there are definitely times when it's a red flag that needs your attention. If you experience heavy bleeding, severe cramps, or notice a foul odor accompanying the discharge, it's crucial to see your doctor right away. For those who are pregnant, heavy bleeding or bleeding accompanied by pain could be a sign of a miscarriage or other pregnancy complications. It's essential to contact your healthcare provider immediately if you experience any of these symptoms. And ladies, if you're postmenopausal and notice any red or pink discharge, don't brush it off. This can sometimes be a sign of endometrial cancer, a type of cancer that affects the lining of the uterus. Remember, when it comes to your health, it's always better to be safe than sorry. All right, ladies, let's switch gears and talk about white discharge. Now, before you jump to conclusions, remember that white discharge can be totally normal, especially if it's thin, watery, and doesn't have a strong odor. This type of discharge is often just your vagina's way of keeping things clean and balanced. However, if your white discharge suddenly resembles a cottage cheese convention, thick, clumpy, and possibly a bit itchy, it's time to pay attention. This could be a sign of a yeast infection, also known as thrush. Yeast infections are incredibly common, affecting nearly 75% of women at some point in their lives. They're caused by an overgrowth of a fungus called Candida albicans, which naturally lives in your vagina. So, what causes this fungal fiesta in the first place? Well, a number of factors can tip the scales in Candida's favor. One of the biggest culprits is antibiotic use. While antibiotics are lifesavers for bacterial infections, they can also wipe out the good bacteria in your vagina that normally keep Candida in check. Hormonal changes, like those that occur during pregnancy, menstruation, or menopause, can also increase your risk of yeast infections. Essentially, anytime your hormone levels are doing the cha-cha, it can create an environment where Candida feels right at home. Other potential triggers include stress, wearing tight or damp clothing, and using scented soaps or douches. Basically, anything that disrupts the natural pH balance of your vagina can create a breeding ground for yeast. The good news is that yeast infections are usually easily treatable with antifungal medications. These come in various forms like creams, tablets, or pessaries, which are inserted into the vagina. It's important to follow the instructions provided by your doctor or pharmacist and complete the full course of treatment, even if your symptoms start to improve. While treating a yeast infection is important, preventing them in the first place is even better. There are a few simple steps you can take to keep Candida from crashing your party. First and foremost, ditch the douches. Your vagina is a self-cleaning oven. It doesn't need any help from harsh chemicals. Opt for breathable cotton underwear and avoid wearing tight-fitting clothing for extended periods. And when it comes to washing your lady bits, stick to mild, unscented soaps and water. Let's move on to another type of discharge that often raises eyebrows: gray discharge. Now, don't panic if you're seeing gray, but it's definitely a sign that something's not quite right down there. Gray discharge is often associated with a condition called bacterial vaginosis, or BV for short. BV isn't technically a sexually transmitted infection, STI, in the traditional sense. It's not caused by a foreign invader, but rather an imbalance in your vagina's natural ecosystem. Imagine your vagina as a delicate garden, home to a diverse community of bacteria. These bacteria, mostly the good kind called lactobacilli, work together to keep things in harmony, maintaining a slightly acidic environment that keeps unwanted guests at bay. So, what causes this bacterial brouhaha in the first place? Well, unlike STIs, BV isn't spread through sexual contact. However, sexual activity, especially with multiple partners or a new partner, can increase your risk. Other factors that can tip the scales in favor of BV include douching. Seriously, ladies, ditch the douching. Using scented soaps or feminine hygiene products, and even smoking. Basically, anything that disrupts the natural pH balance of your vagina can create an environment where the bad bacteria feel right at home. Now, while BV itself isn't considered an STI, it can increase your susceptibility to other infections, including some STIs. That's why it's crucial to address BV promptly and restore your vagina's natural balance. The good news is that BV is usually easily treatable with antibiotics. These can be prescribed by your doctor in either oral or topical form, usually a cream or gel inserted into the vagina. It's essential to complete the full course of antibiotics as directed by your doctor, even if your symptoms start to improve. While treating BV is important, preventing it in the first place is always the best approach. And the good news is that there are several simple steps you can take to keep your vaginal garden flourishing. First and foremost, embrace your body's natural cleansing abilities and ditch the douches. Your vagina is a self-cleaning oven. It doesn't need any help from harsh chemicals or fancy washes. Opt for breathable cotton underwear and avoid wearing tight-fitting clothing for extended periods. And when it comes to washing your lady bits, stick to mild, unscented soaps and water. Now let's talk about the type of discharge that often gets overlooked: clear discharge. Clear discharge is often a sign that everything's hunky-dory down there. It's your vagina's way of saying, all systems go. We're healthy, balanced, and ready for action. Think of it like this. Just like a well-oiled machine needs a bit of lubrication to run smoothly, your vagina relies on clear discharge to stay clean, moisturized, and protected. It's packed with good bacteria, antibodies, and other cells that work tirelessly to keep infections at bay and maintain a healthy vaginal environment. It can range in consistency from thin and watery to thick and slightly stretchy, almost like egg whites. Hormonal fluctuations can influence the amount, consistency, and even the smell of your discharge, and that's perfectly normal. Let's dive a little deeper into how your menstrual cycle can affect your discharge. During the first half of your cycle, leading up to ovulation, you might notice your discharge becoming increasingly clear, stretchy, and slippery. This is your body's way of preparing for a potential pregnancy, creating a more hospitable environment for sperm to travel. Think of it like rolling out the red carpet for those little swimmers. After ovulation, as your progesterone levels rise, you might notice your discharge becoming thicker, creamier, and less abundant. This is totally normal and is simply your body's way of preparing for a potential pregnancy. If fertilization doesn't occur, your progesterone levels will drop, signaling your uterus to shed its lining, and voila, hello, period. Now, while some variation in clear discharge is perfectly normal, it's important to pay attention to any drastic changes or accompanying symptoms. For instance, if your clear discharge suddenly becomes very heavy, has a strong odor, especially a fishy odor, or is accompanied by itching, burning, or pain, it's best to consult your doctor. These could be signs of an infection or other underlying condition that needs attention. Remember, ladies, your body is constantly communicating with you. Vaginal discharge is just one of its many ways of sending signals about your health and well-being. While clear discharge is usually a sign that everything's a-okay, it's crucial to be aware of any changes or unusual symptoms that might warrant a trip to the doctor. If you notice a sudden change in the color, consistency, or odor of your discharge, especially if it's accompanied by itching, burning, pain during intercourse, or bleeding between periods, don't hesitate to schedule an appointment. It's always better to err on the side of caution and get checked out by a professional. Remember, there's absolutely no shame in discussing your vaginal health with your doctor. They've seen and heard it all, and their priority is your well-being. Don't let embarrassment or fear prevent you from getting the care you deserve. Your vagina is an amazing part of your body, and taking care of it is essential for your overall health and happiness. So there you have it, ladies. We've journeyed through the colorful world of vaginal discharge, decoding its signals and busting some myths along the way. Remember, vaginal discharge is a natural, healthy part of being a woman. It's your body's way of keeping things clean, balanced, and functioning as they should. Just like you wouldn't ignore a flashing warning light on your car's dashboard, don't ignore what your discharge might be telling you. Pay attention to its color, consistency, and smell. Notice any changes or accompanying symptoms. Knowledge is power, and understanding your body's signals can help you take charge of your vaginal health. Let's ditch the shame and awkwardness surrounding vaginal health. Talk to your friends, your sisters, your daughters. Share this video with them. Let's break the silence and create a world where women feel empowered to discuss their bodies openly and honestly. Remember, you are not alone. Millions of women experience changes in their vaginal discharge, and there's absolutely no shame in seeking help when you need it. So listen to your body, trust your instincts, and don't hesitate to reach out to your doctor if you have any concerns. Your health is worth it.